Glaucoma is sometimes called the silent robber of sight because people with glaucoma can permanently lose some of their vision before they're aware of any symptoms of vision loss. Glaucoma comes in many forms, but basically glaucoma is a condition in which the internal pressure of the eye gradually or suddenly becomes so high that it causes damage to the delicate optic nerve at the back of the eye. The eye maintains a normal range of pressure by producing fluid behind the iris in the ciliary body. The fluid travels around the lens and exits the eye through the eye's natural drainage system called the trabecular meshwork. When this drainage system stops functioning properly, pressure builds and causes permanent and irreversible damage. Treatment and prevention of vision loss is accomplished by several methods. Various eye drops alone, or in combination, as well as oral medications, can be used. If these medications do not adequately control the pressure in your eye, a laser treatment may be used to attempt to lower the pressure. However, in some glaucoma patients, drops, oral medication, and laser treatments do not sufficiently control pressure. For these patients, a procedure called trabectulectomy or filtration surgery becomes necessary. Creating this new filter out of the eye should lower the pressure. The procedure is usually done on an outpatient basis and under a local or general anesthesia, whichever your surgeon prefers. To create the filter, your doctor will make an opening into your eye overlying the normal drainage channels. First, the conjunctiva, or clear tissue, is opened. Then a small section of the rigid white tissue of the eye, called the sclera, is dissected back. A small rectangular section of the sclera and the trabecular meshwork are removed from the eye, thereby creating an opening to the outside of your eye. The opening is then partially sealed by the remaining sclera, and then again covered by the conjunctiva. Fluid from the eye can then percolate up through the partially closed sclera and be absorbed back into the bloodstream under the conjunctiva at a controlled rate. This new filter is called a filtering bleb. After surgery, the pressure inside your eye will need to be frequently monitored at the office. There is a very fine line between too much filtering and not enough filtering. If the pressure is too low or too high, there are minor office procedures that can adjust the rate of filtration. Initially after the surgery, the pressure in your eye will be too low, which will cause your vision to be blurred. Both low pressure and blurry vision are normal and to be expected. You will also be given various eye medications to use after the surgery. The frequency and duration of this medication differs with each patient. As the healing process continues, the blurred vision should diminish, and the pressure should build back up to an acceptable level. However, glaucoma medications may still be required to keep your pressure at acceptable levels. It's important that you know that, as with any surgery, there are some risks and complications associated with a trabeculectomy. Some of these risks include loss of vision, cataract formation, filter closure, choroidal detachment, hemorrhage, overfiltration, and infection. Some of these complications may require additional surgery. If you have any questions about any of these complications, be sure to ask. With your full cooperation to post-operative routines, your doctor and staff will do everything possible to ensure you have a successful and uncomplicated result. In about 75 to 80% of all cases, pressure is successfully controlled with medications at a safe level so that no further damage will be done to the optic nerve.